From the heart of global journalism to your screen,
This is GNN, Global News Network.
I am Raimel Perong, and today we bring you a special report on one of the most overlooked humanitarian catastrophes of our time, the ongoing genocide and mass atrocities in the Democratic Republic of the Congo, or DRC. A crisis that has claimed millions of lives and continues to destroy communities while much of the world looks away.
And I am Gerald Notwell. Raimel, since 1998, more than 6 million people are estimated to have died due to conflict, hunger, and disease.
Thank you, Raimel and Jay. I'm reporting from Eastern Congo, a region scarred by decades of conflict. The scale of displacement alone is enormous. As of 2025, the number of internally displaced people in the DRC has reached at least 7.3 billion, with tens of thousands more fleeing across borders. In 2023, medical team from Médecins Sans Frontières treated 25,166 survivors of conflict-related sexual violence across the DRC, a highest number recorded in the country's history. That's more than 2 victims every hour. Even worse, in 2024, the surge continued. In the first 5 months of 2024, in the province of North Kivu alone, MSF provided care to 17,363 survivors. The scale of sexual violence in the DRC is staggering, but even these numbers represent only a fraction of the true extent. For decades, the region has been plagued by systematic use of sexual violence as a weapon of war. According to data from Panzi Foundation, the institution founded by Nobel laureate Denis Mukwege, since 1999, their hospital has treated more than 83,000 survivors of conflict-related sexual violence. That averages to roughly 3,300 survivors every year. Beyond violence, humanitarian needs are overwhelming. According to the latest assessment by the International Committee of the Red Cross, or the ICRC, as of 2025, 85% of health facilities in North and South Kivu are experiencing severe medicine shortages, and nearly 40% have lost medical staff due to conflict. A recent 6 hospital sample supported by ICRC, 3,422 wounded patients were treated, a 60% increase compared to the same period in 2024. At the same time, 227,000 medical consultations, more than 71,000 vaccination appointments, and 24,200 antenatal sessions were recorded, a sign of how medical demand has skyrocketed. Yet, these efforts barely scratch the surface. In many conflict-affected zones, violence, looting, and military presence prevent aid delivery and healthcare access. Back to you, Raimel and Jay.
The tragedy in the DRC doesn't stand alone. Historically, genocides and mass atrocities, whether in Rwanda, Bosnia, Darfur, or the Rohingya crisis, share similar patterns. Mass killings, targeting of civilians, sexual violence, displacements, and systematic dehumanization. The conflict in Congo embodies the same horrors, but with fewer cameras, less global outreach, and minimal media coverage. This special report reminds us genocide isn't a distant memory, it is ongoing. And silence, indifference makes it worse. The numbers speak. Millions dead, millions displaced, tens of thousands of women and children raped, countless more denied medicines and a chance to rebuild.
For viewers, knowing isn't enough. What matters is what we do with that knowledge. Support humanitarian initiatives, demand transparency from corporations and global supply chains, and speak.